Hi, good morning everybody. So today we're going to be looking at a bit of shoulder pain, shoulder impingement. Warwick here is very kind to help us with this video today. So he came to me complaining a bit of shoulder tightness, a bit of shoulder pain on both shoulders. Doing a little bit of investigation, we're thinking there's a bit of shoulder impingement. So some of the signs, we're going to go over those and we might do a quick little test. So to check for the shoulder impingement, let me know if any of this hurts, okay? So we're going to just see if any of your tendons are getting pinched in the joint. So let me know if this hurts at all.
No pain.
No pain. Any tightness? Try to relax your shoulder. There you go. Good.
It's very tight.
Very tightness?
Mm-hmm.
Okay, good. Let's check this side. Awesome. And same thing. Let the shoulder relax. Awesome.
Tight.
Tight, yeah.
Mm-hmm.
Feels about the same both sides. Does feel a little tight. Okay. Now, Warwick is a martial artist, so he does Muay Thai a lot, and that is his profession. So can you show me your stance there, Warwick? So just so we can get an idea of how you're in usually.
Okay. So yeah, we spent a fair amount of time actually in this posture here.
Okay, just like that.
Yeah.
Okay. So you can see kind of the shoulders are always forward, very protracted, both sides, more so on the right side especially, right? Trying to get tucked in to dodge all those incoming punches, right?
Protected.
Okay, yeah, so that can create a lot of impingement because you're bringing that shoulder a bit forward on both sides. Okay, awesome. So have a seat, relax. Let me show you real quick what that might be going on. Okay, so this is your shoulder. Right, your typical shoulder. This would be on your right side.
Right.
So it would look like so. Okay. Very attractive shoulder. Okay. Awesome. So when your shoulder is forward, like so, when you're in your stance and your shoulder is forward, tucked in, what you're doing is you're moving that arm forward like this. Okay. You see how that brings you a lot closer. So this is your supraspinatus, one of your muscles, right? Brings you a lot closer to the acromion, to the bone. So when you're forward like this, you close off that space. So whenever you're trying to move the shoulder, so for example, if I'm forward and I try to raise my arm, it's about as high as I can go because it's starting to hit up here. Okay? That's where you're getting a lot of that tightness because your capsule is really tight at the back and you've kind of pinched that shoulder muscle at the front. That's what that test was simulating. Okay. So what we're going to try to do is we're going to look at some of those factors that cause this, and we're going to see how we can treat that and see if you're going to feel a bit better after this.
Okay.
Sounds like a plan?
It does.
Awesome. Let's get started. So just looking at the posture and the positioning of the shoulder, so we're seeing a bit of the shoulder here. So there's your actual ball and socket joint. Okay. So if I get you to face forward, we can see how that's kind of moved forward. Ideally, your shoulder should be in this position, and that would open up the space in here to not allow you to pinch. Okay, so when I let go, it ends up kind of moving forward, and you see that there. Okay, and that's where you're getting the supraspinatus getting stuck. Now, as we move to the back, you can see here's the shoulder blade. You can see a bit of an obvious kind of tipping. So shoulder blade is a bit angled like this, where I can kind of get my hands under there, and that's just telling us everything is rolled forward like that. So ideally, again, the shoulder should be flat against the thoracic cage so that you shouldn't be able to actually see anything or get anything under here. And that comes from a bit of pec tightness in the front and kind of less activation in that serratus anterior muscle, the boxer muscle where you get those little fingers showing off there, right? It should be nice and flat like this. So we'll do a bit of treatment and let's see how the shoulder feels after. Sure. All right, so we're gonna do some pec minor stretches for that tipped forward shoulder. Then we're gonna do some joint mobilizations to get that shoulder to move back a little bit easier. All right, ready, Warwick?
Yes.
Let's do it. So you're going to start to feel, let me know if anything hurts, but you're going to start to feel a bit of a stretch between my two hands. Feel that?
Yep.
Awesome. So we're getting that pec minor between my two hands, nice and stretched, and that's allowing the shoulder blade to tilt backwards, hopefully reducing that winging where I had my fingers in there. Good. And then let's do a little bit of joint mobilizations. Okay, stay nice and loose. Okay, you should just feel some pressure in the back of the shoulder, okay? So it feels a little restricted right at the end, so that's where we're gonna work. And that's gonna just help you be able to keep that shoulder a little bit further back. Doing little oscillations. You're feeling that back there?
Yeah.
Awesome. Gonna go a bit deeper. Awesome. You got your pec nice and red, eh? From the stretching. Alright. Okay, feels a little bit better. We'll do it one more time. Alright, cool. So we just did some pec minor stretching, which you could see the redness there. Sorry, buddy. Okay, so I got some pec minor stretches. We got some inferior moves to try to open up that posterior capsule. So does it feel a bit easier to keep your shoulder a little bit further back? You're moving that.
Oh, further back, yeah.
Yeah. Okay. And how about let's just do some basic movements? Crossing forward. Okay. How about moving the arm, shoulders up?
It feels free.
Feels a bit more free.
Yeah,
That
that's
side,
restricted.
we haven't done it yet on that side, so do you feel the difference between the two?
That's much tighter on the left side.
Yeah? Okay, so let's do that same test that we did in the beginning. Okay. Okay, and let your arm go totally loose, and let's see if it feels as restricted or tight as last time.
I still feel the tightness.
Still a little tight? Any better than before?
Didn't really register the
How much it was?
previous.
Yeah, well, it's definitely moving further. I didn't get you down this far when we first started, so that's a little bit good. That's a good sign. And in general, if we come to the back, we're gonna see that winging has been reduced a little bit. So before we did it on the other side, but I could still get my fingers under last time, but now it's a lot better. It feels a bit flatter. So definitely work in progress, but you can see how it works. Awesome, great. So we'll see you again, and we'll keep going at it.
Sure, thanks.
Awesome.